Do you have any questions from the audience?
Yes.
Good afternoon. My name is Nabila, and I was wondering, when you're birthing your idea during the development initial stages, how do you ensure that your intellectual property is protected, even when you're sharing ideas with other people? And secondly, for the apps that deal with now the healthcare professionals, like telemedicine apps, how do you qualify the doctors? And is there I'd like to hear about the process of qualification just to ensure that they're good enough.
Thank you. My question goes to the whole team. On digital health, we have scams. There are guys who call themselves Daktari and they go online, like TikTok, wanasema I'm selling this, ukimeza hii utamaliza kitambi in the next 2 days. Ukimeza hii, it's a contraceptive. You do this, it will do this. Are there deliberate efforts or brainstorming around how you can counter-attack the fake, service providers that use them?
I think
our regulators mostly at the moment, and support them and just create awareness. Be shameless about it. If a guy is asking, I'll call him out. That's what I'd say.
Thank you. I think I will just mention about IP, and that will be based on my experience. So when we started developing a phototherapy machine, we knew there were already phototherapy machines on the market. And so we were like, what novelty are we bringing on board? We didn't even know where to start from. And so the first thing we did is we looked around. So in Uganda, we have the Uganda Registration Services Bureau. So we reached out to them and they told us the different forms of IP, a patent, a trademark. And we said we got to call a utility model. So that is more like, it's not new, but I'm adding something onto it. And then I have to describe the novel part of it. But again, like he has said, if you're looking out for partners in the very beginning, you can't start out with saying, I'm not giving you anything because no. But also when you're working with people, you let them sign a non-disclosure agreement that whatever we're working with here, do not take it out. But you need to move fast. And once you realize your idea is novel, you've reached a particular point of an MVP, or even before that, start the process of getting an IP. And you need to reach out to people who have been there before, and they tell you what elements of your innovation need protection and what doesn't need protection. How much you have to give out and what you need to give out, because you can't come at a conference and just let it out. And then about the qualification of health workers on the telehealth, I think the people in that space will talk about it. And about works, one is you have to start with yourself, ensuring you're giving all the right information. And when you're giving all the right information, then you have a voice to tell the regulators that, hey, I don't think this is right. But again, it's very difficult if you're working in an unregulated environment. This happens in Africa. In Europe, it's a bit more difficult because you need to have a very clear line. But I think the best thing is do the right thing and build traffic in your lane as you wait for the government or the regulators to work out in your favor.
Thanks for those questions. When the first speaker asked, or rather the first question was asked, I remembered how at the beginning I was a little naive myself. So I would speak to anyone and everyone about what I was thinking. And hey, can you imagine doing this? Can you imagine doing that? I never really realized that I was giving away my IP. Until someone asked me, hey, have you patented this? And that's when I thought, hey, I better actually think about that. So I had to delve into the whole thing of what the laws say. So interestingly, our laws in Kenya, because you have laws that apply in Kenya, laws that apply in Africa, laws that are global, and licenses that are following those regions. It's definitely much easier to patent a product, a physical product, that you can easily patent. But to patent a process is a totally different story. So ours was actually a process. It was that, yes, you can go to such and such a place, you can connect this way and that and get the job done this way. So that's very difficult to patent, mainly because if you change any part of that process, you have to get another whole new license. So it's practically impossible to patent a process the way the laws stand in Kenya. Especially such an IT process, such a service process. I'm distinguishing it from, let's say, a chemical process, or one of those. So remember, the laws in IT are very young, and at that time there were no laws. The digital health bill that just came out, just came out. I was honored also to be, and I think Doc mentioned that he was there, I wasn't aware, but so we were there together during the technical working group. I don't know when you started, but so we were there during the development of the digital health bill. It was a very long process because COVID came in between and interrupted the whole thing. But finally, it's good to see it published as a law. And I also was there for in the technical working group. Both of these were for the Ministry of Health, the technical working group for the national guidelines and standards for telemedicine. So connected to that is what you talked about, the aspect of the first question, the aspect of the doctors and making sure they're all regulated properly. Before I go there, let me finish with the IP. It's something important to mention. Apart from the lack of not being very practical to patent a process because of the changes, it's also very expensive to patent some other IT products. I'm thinking of mPost. Some of you may have seen mPost. This mobile company that now converts your mobile phone into a PO box sort of thing. Yeah? So I know them quite well because at some point we were doing some training together. So their patent cost 5 million shillings, just the patent. So they got enough loans to get that patent. And fortunately for them, they were able, that patent was very straightforward and applies to any post office service. So basically, they have the patent for the whole continent. Right? So I'm just giving an example of what some of those patents can cost. And therefore, one can decide to move through the process of patents, etc., or one may just move quickly to the market and provide a good quality service and attract clients that way. So rather than try and limit other players using the same process, you just go to the market and provide the best quality service that you can. And that way you win over your clients. You should patent your name and your brand name and everything. And a lesson learned is, you may patent a trademark, but also patent, well, the business name is patented, is registered. But ensure that your trademark is also registered. So I'll give an example. So Daktari Africa is Daktari Africa, that's our trademark. But if a company comes and calls itself something close to that, then the trademark is the trademark and the business is the business. If you follow me, you follow me. So, basically, our company is called Dr. Search Limited, but our trademark is Daktari Africa. So ensure that you protect the names, otherwise other names will come about, isn't it? So moving on to the aspect of regulatory approval. So regulatory approval is very important. So when we started off in 2008, there was no regulation about telemedicine, and but I realized that since we were going to be working with doctors, and touching also on the other question, since we were going to be working with doctors and with medicines, because I also wanted us to be distributing medicines to patients, online pharmacy, I ensured that we went to the Medical Practitioners and Dentists Board, to the board at the time, and to the Pharmacy and Poisons Board. I introduced ourselves. They had no idea what telemedicine was, at least not the level that we know now. They had some idea, but not really. And I told them, look, this is us, this is what we do, and would like you to register us and to recognize us. So we were like, what? Yes, please, just go ahead and register. So we had to go through that process. The medical board, and then the pharmacy board was a little more rigorous. They took us through 3 months of finding out how we have online consultations, and the whole thing of having a physical copy, and if it's the regulated drugs, you should have a copy by this time, and 1 week, 1 day, the whole thing. And eventually they gave us the recognition. And the reason I did that is because I knew there would be many other players who would come in for telemedicine. And it's really good to see that many, because I knew this would be a very crowded space. It's like someone who puts up a hospital somewhere, the first time in a country. There will be many other hospitals there. So I wanted everyone to follow that route, and that's exactly what's happening. And COVID also funded everyone through that. So that's good. That way we have a bit of regulation and stuff like that. So about vetting of doctors and how to ensure we don't have quacks and other traditional herbalists coming in, because they sometimes try to. For Daktari Africa, our model is to open up. So when we started, my idea was to have doctors whom I knew to be available on that platform so that patients could see them. But the concept of telemedicine, the way also someone mentioned it, I'm very glad to hear it, is that telemedicine platform is essentially an online hospital. I remember talking about that a few years ago. And the whole idea of a hospital is to bring in doctors online, and you bring the patients. So we started with enlisting the doctors. So I only got the 6 doctors whom I knew, and I said, these are the only ones that I'm working with. And as we go, I remember we would go to conferences and enlist more doctors. And I said, that's it. And a friend of mine, he's in IT, told me, why don't you open it up? Let the patients be the ones to vet and to rate the doctors. So that's how we ended up now with the largest number of doctors who do telemedicine. Telehealth is very wide, but telemedicine per se, that's a pretty large number. There are others out there. But the point is that when you open it up that way, then you need to be careful. So what we do is, even on our registration, a doctor is signing up, because ours all sign up voluntarily. Then, the first step involves our vetting them. So we go through the board, we ensure that they are up to date, and then we publish. So there are many more doctors who have signed up to Daktari Africa than are published, if you open the website. So we work very closely with the medical board. The other thing we do is facilitate education for our doctors. So we have CNAs, we've organized conferences, we've held master classes for cardiology and others, and that's exactly what we do. So the thing here is, rather than seeking to just isolate yourself, back to the IP question, it's also important to ask yourself, what distinguishes you as an innovator, as the product that you have, what distinguishes that product from the others? Because now you're seeing the 4 of us here. If we held this in another 1 year, you'll probably see many more people. In other words, many more providers of telemedicine and the rest. What distinguishes you from the others? And similarly for the AI and stuff, we've heard about how AI is really coming in and digital health and stuff. So what makes you different? What makes you different from that machine? What can you provide to the patient that no AI can do? So that distinguishing mark is also very, very important.
Thank you. I don't know where do I begin. The issue of the so-called fake doctors, and there is a big fight, especially in Africa, because no matter how much we have more med schools, more pharmacy schools, there's still margins of those who are called them traditional. All right? And I know this, I don't know how far that bill is, you should call alternative medicine. And I know Cambridge are doing some research on that. I think that's the data they want to use maybe to whether to disapprove or follow up with that bill. So it's a very dicey issue. As far as we're concerned, they are not recognized by law. As far as we're concerned, despite that, we still see them advertise themselves. Yet the legitimate doctors trained through the government programs are not allowed to advertise themselves. I mean, so there's a bit of conflict and some mushy areas in terms of law and policy in that. In terms of KYC, I know the Medical Council now, technology said it goes before legislation, and Medical Council was caught by surprise with you guys who began the telemedicine, and they didn't know how to regulate you. I'm saying that because at some point I also played in that field. And during COVID, over that period, they actually came up with a law that every telemedicine solution must have where the buck stops with, and it must be a hospital. I hope you understand that. And this conversation, I had it amplified during the recently conference of nations in Kigali, where all the 26 countries regulators were meeting, and they were just trying to address the emerging issues in the practice. And telemedicine was one of them, and now they were trying to share country experiences, how they are regulating it. And of course, Kenya shared its experience, how now they are mandated. Every telemedicine solution must have a hospital where the buck stops with. And some of the other things, as you mentioned, that telemedicine is an online hospital. Some of the requirements that are needed, you must, and I guess the question was KYC. How do you know that this is really a doctor or this is really a qualified practitioner? So one, make sure you confirm. Either they upload their practicing license, because again, if you're dealing with people who are not renewed their license, they're illegally practicing, whether virtually or physically. And number two is something they call, and which is a mandatory right now, professional indemnity. In case there's misdiagnosis, in case there's a case, in case what happens, all right? So those are the two key things. Even physically, doctors are required to do that, and I'm sure this is happening to many other professionals around that. As for us, Daktari, our platform is for training. We don't have so much risk, but all we need to do is to verify that you're a healthcare practitioner. Some of the content we host is not for the general public, it's only for the trained healthcare professionals. So you must, if you're a pharmacist, we have over 7,000 pharmacists using our platform, you must input your board number, and that board number will be cross-checked against the Pharmacy and Poisons Board register. The same happens to the other cadres. We are registered, we are accredited by 8 regulators, the doctors, the nurses. Uganda, actually, I'll have a conversation with you. We recently got Uganda, accredited by Uganda Medical Council. We have the clinical officers, we have the Pharmacy and Poisons Board, Physiotherapy Council, Rwanda Pharmacy Council, and the Medical Lab. Lastly, let me talk about the IP. As I think I exactly share your story. When you're beginning with an idea, number one, you can never patent an idea. And this I've always spoken because I learned it the hard way. You can never patent an idea. You don't know how many people have that idea. You can say it's my head, let me write it and just in the future. You don't know when you're unafichanga answer zako, upelekea regulator akupatentia. You can't do that. So the only thing you can do, as I said, products are easier, physical products are easier to patent, and as you also said, it's not as easy as you think, because rarely do you come up with something very unique. So what you usually have is utility patent, and I think it's the same policy. There's a world body that is called WIPO, World Intellectual Property Organization. And in Kenya, we have Kenya Industrial Property Institute. It's in Lavington, James Gishuru Road there. And they are the ones who give you this. And it's a process. There are several forms. You just go to their website, kipi.go.ke, and you'll find the process and how they do that. Even for us, it was hard. We tried thinking, what would we do? And the only way you can protect yourself is when you're having conversations, maybe have NDAs or have some sign here, we are talking with you, I'm giving you some information, have that as your sign. Otherwise, not much you can do about it, right? But as I said, some of the things you could have is trademark. And Daktari, I'm surprised that the company is Daktari Media Africa. I almost got Daktari Africa, but you got it protected. But we patented Daktari Online, as in our trademark is Daktari Online. The other thing you should know, trademarks or patents are jurisdictional. They are per the region. So if I say Daktari Online is registered as a trademark, it's only in Kenya. If I need it for more countries, I pay more. That's actually how it is. And they expire. They are not for lifetime. You should also know that. They expire after every 10 years and you need to renew them after every 10 years. I hope that helps.
I think speaking about having patented a trademark and your name, the word Daktari is very famous. A friend of mine is having a similar telemedicine thing in Rwanda, and the first name we thought about was Daktari Consult. And then someone said, but there are so many of those things. So right now he's having a debate on what's the name. And I think you need to be very careful about the name that you choose to patent, because you don't want it to be confused with another brand. Otherwise, then you lose customers, you lose money, and you don't stand out. So again, as you decide to choose what to patent, what is the novelty, what is the uniqueness in whatever you're getting intellectual property about? Thank you.
But it's interesting that in Tanzania there's another one called Daktari Africa. But this one is actually not a telemedicine platform, but it's an organization for doctors to be coming in and doing their stuff. But the whole concept of why Daktari Africa, when you spoke, you said it should even be beyond Africa. The reason why I kept it, I'll answer you now, why I kept it Daktari Africa is because we'll get to a point, believe it or not, when things made in Africa will be the ones that sell. You remember a time, who are the oldest guys in the room? Do you remember a time when you would see made in America and you say, that's the one? Yeah. Made in Germany and you say, ooh. Now, it will be made in Africa. Yes. And did you know, for example, digressing just a little bit, Derek, did you know that the center of knowledge for the longest time was actually Africa, specifically Egypt? That was the center of knowledge, global knowledge. Alexandria, to be specific, is where the library of the biggest library of the world was. And so when it burned, actually there were 3 fires, but the main one, which was just around 300-400 BC, when it burned, it was a global disaster, right? Africa, Egypt was where the first, what? Who knows? Let me digress a little more, right? Not too far. There was some research that was done by somebody called William Osler. Anyone heard of him? Osler Stones and the rest, the doctor is here. He was the physician of physicians, right? So William Osler was given a huge grant, going back to the grants, by a very rich widow in the US to find out the origin of truth. And in his case, there were 4 professors. One went to check about in the line of chemistry, the other one went for astronomy, there was physics, and William Osler was given the unlimited grant for medicine. This was at the end of the 19th century. To go deep, the deepest level they could go without mentioning the word religion. So William Wilson had all the money in the world to go around any part, right, and find out anything and everything about medicine. So he wrote many treatises, and he discovered one thing. William Wilson, remember, is a Canadian, born around Montreal, was one of the founders of Johns Hopkins University, and so those people who were given the grant were the 4 professors of Johns Hopkins, right? So he discovered, I'll tell you the answer, that the first doctor in the history of humanity, the first documented doctor is who? Dr. Imhotep. Imhotep, who was from which country? Egypt. Which century did he live in? 26th century BC. 26th century BC. So he was a physician, he was an architect, he designed the pyramids, he was, of course, the pharaoh's physician, and that was the caliber of Africans that we had. Such that the knowledge that was in Egypt was what influenced the Greeks. So the Greeks would come to Egypt to learn. And the Greeks influenced who? The Romans. So the Roman architecture, Roman engineering, Roman law comes from where? Greek law. Which comes from where? And the Romans influenced what? The whole of Europe and the US. Are we together? So that is why I named it Daktari Africa, because we'll go full circle and people will say, we want stuff made in Africa. It's already happening. See, they're all coming. See, they're saying now these are the largest, this is the best, this is a place which will have the most number of youth in the world. Did you know that by the year 2050, more than a third of the world's youth, the largest proportion of the world's youth, will be in Africa? So our strength is in our numbers. Our strength is in our numbers. The more we are, the more powerful we are. Just like, that's why China and India are so powerful. Right? So let's always remember that. And let's remember we need good education and good health. That's why now we are in the space of health. To make sure that we are strong, we are many, and from solid families, so that everyone is stable, productive, efficient, and the list goes on. You can see Derek if you take a few steps. It's lunchtime.
Let's give them a round of applause. I think ending it on a Pan-Africanist vibe is a very good way to end this plenary session. I'd just like to challenge you to think about, on the digital health perspective, think about the risks that come with artificial intelligence, data privacy, data confidentiality. That is a question I was going to ask, but in the interest of time, I will not ask it. Please reflect on it over lunchtime.